right now the foot is not going to be on the table. It's going to be on the air. Listen, I mean, you get a football player. Maybe you're going to have a hard time already having the leg up like this. But if you can do it, grab the tibia and bring it anteriorly to test how the ACL is doing. Okay? Like 25 degrees of flexion, maybe a little bit more. Anteriorly, you glide anteriorly to test the ACL. Again, are you going to be able to do this on every person? No. This is good for kids.
No.
When you give Brad such a huge muscular lower I don't know about that laughing.
Why wouldn't you put the foot on the table?
For the second one, Lachman's, they say, is a little bit more accurate than this one. That's what they say, right? Now, Lachman, you're not weight bearing, so you're actually having a little bit more of an open pack position with Lachman test. So you're taking it both ways, one with weight bearing, one without weight bearing. When you have weight bearing, the problem is the muscles right here, the hamstrings muscles, when you do this, sometimes they tend to tight a little bit more in this position. So it will give you a little bit of a different inside of the ACL. So right now, I'm not crushing her foot. Tibia plateau with my thumb, so I know where I am, and just don't be afraid. Say, a little bit. No, just go ahead and. You're not gonna break. You remember, ligaments are pretty strong.
Pretty strong.
How do you know if this is too much or not enough? You test it first with the good leg, and then compare with the bad leg. If you see any difference, you see too much of an anterior translation of tibia, that might be a problem. All right? That's the anterior drawer test. Posterior drawer test, same thing. You just go posterior. How can you have heard the posterior, the PCL? Just plain, you fall on your knees, and that can cause a PCL tear. Or you're on the passenger side, you get into an accident, dashboard comes here onto your tibia, you get a PCL. All right? Posterior sag sign, leave the leg right there. And if you see like a little bit of a sagging of the tibia, that might be a problem with the PCL.
I have hyperflexible.
Okay, remember, there's some people that are flexible and lax, so you gotta compare with the good side. Don't send the patient saying you got a ACL tear or PCL tear. I mean, you're gonna freak them out for no reason. You know what I mean? And maybe they end up having surgery because of you. No, I'm just kidding, but you might scare him for no reason. All right, valgus test. Let me see Jenny. I think Jenny had a little bit of an issue. Go ahead on your back.
Here's my shot. I'm just kidding.
Let's save that one for the other two. Now, valgus, stress test, and varus. Now you can do it with knee straight. And what you're going to do, you're going to apply a medial force, right? sometimes you also do it with knee in 30 degrees of flexion. So what am I doing? I'm applying a medial force. You can have some pain. What happens if you don't have any pain and this thing moves all over it? Very big chance of that ligament being torn, which is the MCL. So we're testing the MCL right here. If there's any pain, there might be a tear. If there's no pain at all, but there's a lot of mobility, it might be a complete tear. Now we're doing the Ferris test. Knee straight. I'm going to apply lateral force, or knees at 30 degrees of flexion. Same thing. You look for pain, for discomfort, for laxity. That's for the LCL. Now we're going to test. Go ahead on your stomach. Now she had a suspicion of having some meniscus issues. Now had the Apley's test. It can be distraction, it can be compression. So if I'm doing a compression test, what do you think I'm testing? The ligaments or the meniscus?
The meniscus.
You know, meniscus compression, and then you're grinding them up a little bit if you see if they have a little bit of pain or not. What am I doing here? I'm going to stabilize the leg. I'm not going to cut the circulation of the leg. I'm just going to make sure that she doesn't go anywhere. A little bit of distraction, and then I'm going to perform a little bit of a rotation. Internal, external. Distraction. Are you okay, Jenny? So I'm testing the ligaments, MCL and LCL. Now it's compression. Compression, and I'm going to do the same thing. You're right, Jenny? This way? This way. Like a lot or so. We're going to do another test for the meniscus. Hopefully we have it in your list. Yes, we do have it. Hold it. Go ahead and lie down on your back this time. Now, the McMurray test is a little bit confusing sometimes. Because first of all, the first one, you go a little bit of external rotation and a little bit of valgus force, and you're going to do an extension at the same time. You're right? Anything? Now I'm testing.
Isn't it her other knee?
That's the lateral meniscus. Yeah, isn't it the other knee that you tested the other test?
Checking.
I'm just checking one.
Herring, yeah.
You're pretty mobile, Jenny. You feel that clock here, but it doesn't hurt. I mean, not on this one, not this way. Okay, any problem with this? Let's go to the suspicious leg.